That condition actually affects our movements, and you'll find the patient in this condition having something like kutetemeka, the tremors, difficult on moving with a lot of instability when they move, and body stiffness. So briefly, that's how I could put it. Briefly, it's a disease concerning the function of the brain.
Ugonjwa unaweza ukatibika?
Yeah, it can be treated, yes, but you need to understand, we need to agree what we call treatment and management, because for the moment till now we don't have a cure, which means there is no drug which will reverse all those damage which happened on the nerve cells in the brain. But of course symptoms can be controlled. So that molecule which is lacking in the body can be replenished through medicine, and symptoms will be controlled. If someone was having difficulty on writing, he can actually improve. So there is a big difference when you don't treat and when you treat. Though for the moment we don't have a cure to start to suspect if you have some of the symptoms, though they are not very specific. So they progress as those damage happening at the nerve cell level, the movement, and the early sign. You can have someone with difficulty on smelling, and this goes with the taste. And then on the movement side, it might start by shaking. It might be just one thumb, one finger shaking, like tremor, and then it progresses. And some people will have difficult writing, and the voice might be also very low. But now when the disease is overt and really these molecules are completely down in the body, what happens is someone will start having difficult moving, and some people might even fall, and they feel like they can't lift their foot from the ground. This kind of with instability, even some loss of sight, but can progress to the other side. And another sign is also the rigidity. Someone who could smoothly move his limbs becomes very stiff, and even if you want to help him, you find it very difficult. So they are not very specific. Some people would come with, for instance, shaking. Others will only start by having a masked face. Like now we are. You would find someone like his speech is not accompanied by any gesture, and maybe before even shaking. So the doctor or the healthcare provider diagnosing should be much aware of this kind of different.
Prevention?
So prevention, actually every one of us is at risk, especially after the age of 60. It's usually a disease of the elderly, except in some cases where it comes earlier, when it is running in the family, even from the age 40 there up to 50. But there is no particular cause. Till the moment, no one can tell it's caused by this or that. So now, prevention usually would come if we knew it is caused by this or that. Of course, there are some risk factors, like previous head injury. The diet also plays a lot of role when it comes to Parkinson's, but it's not like a cause-effect relationship. It's just risk, and you will find the majority of the Parkinson's disease patient were actually not exposed to those risks. So at that level...
maoni kutoka kuhusu ugonjwa wa Parkinson, kwamba kama alivyosema ni kwamba wale ambao kwamba maathirika zaidi ni wale watu ambao kwamba wako na umri ya 60.